AIT to take us further on the issues surrounding the coronavirus in the country. We are being joined by the Minister of State for Health and a member of the Presidential Task Force on COVID-19, Olorunibe Mamora, to take us further on the issues. Good evening.
Good evening. Thank you very much.
You're most welcome to the News Hour on AIT.
Thank you.
It's an anniversary, definitely, but not a celebration that anyone will want to be involved in or even remember. 365 days gone by with the issues and pains Nigerians have had to go through, of course, indeed, the rest of the world, because of this pandemic. What has it been so far? What can the PTF, the Presidential Task Force on COVID-19, boast of to have done in order to ease the pain and the strain that the lockdowns brought and all the hardships that the COVID-19 pandemic has brought upon Nigeria?
Right. Thank you very much. I quite agree with you that it's an anniversary that we're not too happy to celebrate, but then, be as it may, we have to move on. And my first comment is to extend condolences to the families that have lost their loved ones within this past 1 year. And the second one is to also salute the frontline workers and, the health workers generally that have been involved. Of course, some of these health workers too lost their lives. So my condolences to them, and pray that the good Lord will comfort the families of those that have lost their loved ones. Now, the PTF, as you know, is an initiative set up by Mr. President and to manage the totality of the response activities to COVID-19, which the first case exactly a year ago, February 27th, 2020. And the first thing was to set up what we call the pillars of the response activities. And these pillars of the response activities comprise of surveillance. That's the first pillar. The second pillar of that response activity is point of entry, where we now have to manage the various points of entry, the airport, the seaport, the land borders, and all that. That's the second one. The third one is laboratory, which is very, very important because what we know about COVID is that there are a lot of people who may be out there carrying the virus without actually showing symptoms. And of course, that the fact that you are carrying the virus does not mean you have the disease. There are two different things. It's when you start manifesting symptoms or you start showing signs that we can now say you have disease. So that's why the laboratory pillar is very important. And that's how we came about the molecular laboratories and all that. And of course, later on, we started having the rapid test kits and all that. But the gold standard is the molecular laboratory. And you recall that we started off from a budget of about 3 or 4 molecular laboratories. But as of today, we have close, well over 100. Okay. So then the next is case management. That is, now you have a case. How do you manage? What do you do? In terms of, when we say drugs, just to manage the other things, what we can call the support or supportive management, because you don't have a particular drug as at this point in time that you will say this is a drug that you use in the management of patients. And of course, that led us to having isolation wards, treatment wards, ICUs, that is intensive care units, and all that. Then, after that, you now move on to the issue of what we call the management, the logistics, security, and logistics involved in the process. Then you also have the risk communication, which is very important. That is, you need to let people know what they need to do. We came about the need for us to have NPIs, non-pharmaceutical interventions, use of face masks, which has become very, very important. Physical and social distancing, and of course the issue of avoiding crowd and all that, both at work and at home, and of course restriction of of various sorts. In terms of, we had curfew at a point in time. Again, we had lockdown. They may be seen to be extreme measures, but we needed to do them in the circumstance. So all these pillars, they form part of the response activities, which of course is also infection prevention and control, because you need to, even when you are managing a patient or even at home, what you need to do to prevent infection and control infection. So these are some of the things that we have done to really manage the COVID-19.
Well, Minister, do you think we would have done all that in terms of making sure that people wear face masks? Because I know very well that on the 16th of March 2020, you were asked by a group of journalists, why is Nigerians' airspace still open? And your response was, we have only recorded 2 cases as far as I'm concerned. That number is not significant. That was a response. But now that 2 cases recorded as of February and middle of March has led us to over 150,000 cases in Nigeria and over 1,000 deaths. Now, how do you intend to prepare for other emerging diseases? Ebola is just around the corner.
Well, you see, it's not even just Ebola or Lassa fever or whatever. The truth is that we just have to manage COVID-19 alongside these others. It's not even these new ones, even the routine cases. We still have to manage them. People still present with diabetes, hypertension, heart diseases. People still have to go for antenatal care. We still have to take deliveries and all that. All these are in line with healthcare delivery. So, but what is important, and that's why I mentioned the issue of infection prevention control and all that. And each country will have to determine what is best for you in the circumstance. So we cannot say because people are shutting borders somewhere, we must also do it. No, it has to be within the ambit of the realities of your own situation. And you have your goal, which is to reduce the spread of infection and, of course, manage the cases that present.
So right now, what is the situation in terms of vaccine? When is Nigeria receiving its COVAX vaccine?
Well, all along we know that in this kind of pandemic, the ultimate is vaccine, particularly when you don't have a particular drug that you can say this is for the treatment of COVID-19. So there is scrambling all over the place. Unfortunately, we don't manufacture. We've had assurances, we've had engagements, bilateral and multilateral in nature. I mean, like bilateral, government to government. We're speaking to the government of Russia, you know, because they have Sputnik. We're speaking to United Arab Emirates, Sinopharm and all that. Now, but what we're relying on mostly is the multilateral engagement at EVAT. EVAT is African Vaccine Acquisition Tax Team, which is being facilitated by African Union. Because, and the basis is that, you know, you are stronger together. It's just to ensure that the low and medium income countries, they have access and the vaccine is made affordable to them. The same thing for the international, which is under COVAX, which is being, you know, facilitated by Gavi, Global Alliance for Vaccine, and WHO.
So in spite of all that, we still don't know when, Nigerians don't know when vaccines will be available in the country.
We will have vaccines by next month, in March.
When exactly in March? Because we've been hearing that for a long time. We had January, we had February, now we're hearing March. When exactly in March are we expecting the vaccine?
In March, hopefully about mid-March.
Minister of State for Health, Olorunibe Mamora, and member of the Presidential Task Force on COVID-19. Thank you very much for joining us on the News Hour tonight.
Thank you very much for inviting me.